Thank you for your enthusiasm, and it's great to see so many unfamiliar faces. Today I'm going to tell you about a study that we do in the Netherlands using DEBRICHEM in the primary care. I'm going to tell you something about our organization. Then I'm going to tell you something about the database that we have and how we're going to use this for the aim of the study. Then I'll tell you something about the patient that we've included and the effects of DEBRICHEM as we see them so far. And at the end, I'll tell you what the preliminary results are. So Quality Zorg is based in the Netherlands, and it's a home care organization specialized in wound care. We have over 70 wound care nurses and nurse practitioners, and well, we focus on the primary care. And we've developed our own electronic client record, and this allows us to determine what kind of data we'd like to gather. And we also use this data for the reimbursements for the insurance companies, and we order the products in our system. And combining all this data, it gives us the information on the treatment outcomes, but also on the cost involved. And to give you a sense of how large our data set is, we have over 29,000 wounds and 180,000 visits. So this gives us an enormous data set to compare the results with. Well, the aim of the study is to determine the effectiveness of DEBRICHEM in the primary care setting, and we'd also going to determine whether it's cost effective using it in the primary care. We aim to include 80 patients, and we have a focus on diabetic foot ulcers, venous leg ulcers, pressure ulcers, and traumatic ulcers. And as of that moment, we have included 70 wounds. 23 treatments are already finished, and we have still 47 ongoing treatments. Well, we've included a lot more complex patients that we typically treat. So on the left, you see the age distribution of the patients treated with DEBRICHEM, and on the right, you see our entire database. Well, and as you can clearly see, the patients that we've included are older, so they're typically, on average, 75 years old compared to 70 in the rest of the database. We've excluded 3 patients because they passed away during the treatment, which is logical, I think, if you see how old a population is. They have more underlying illnesses. So if you look at the comorbidities per patient, you can see that on average 1.5 comorbidities per patient compared to 1 with the rest of the database. And there are a lot of patients which have 2, 3, or even 4 underlying illnesses. And the population also had typically more wounds per patient, 4.6 wounds per patient compared to 2.1 in the entire database. Well, we've included the top 3 diagnoses are diabetic foot ulcers, venous leg ulcers, and pressure ulcers. And as you can see in our total database, the vast majority are traumatic ulcers, and here we've included far more, well, diabetic foot ulcers and venous leg ulcers. And I think this gives you a clear indication that the patients that we've included are far more complex than what we typically see in the rest of our database. So keep that in mind when we're going to compare the results. Here I've divided all of our wounds in our database based on the treatment time. So on the left are all the wounds that we've treated for 50 days or less, and on the right are all the wounds that we've treated for 200 days or more. And as you can see, as the treatment time increases, the chance to fully heal decreases. And the vast majority of the wounds, 72%, we don't treat for longer than 50 days. And on average, we've applied DEBRICHEM 138 days after already starting the treatment. And as you can see, well, that would put you around here somewhere. So 91% of the treatments are typically over before you hit the 138 days mark. And well, then the projected outcomes will be also worse. And here I've done the same, but then for the time until application of DEBRICHEM. So on the left, you can see the wounds where we applied DEBRICHEM within the first 50 days of starting the treatment, and on the right, after 200 days treatment or more. And well, as you can see, the vast majority of the wounds are still, the treatment is still ongoing. But for the wounds that, the treatments that are already finished, you can see that a lot of them have already fully healed. So if we just focus on the wounds that were, or the treatments that were finished, you can see that a lot of the wounds that we've included and are finished, well, did fully heal. And it's remarkable to see that as the time until application increases, you see the best results you see within the first 150 days of application. So still not that many wounds, but it does look like a trend so far. Okay, this probably requires some explanation. So on the left, we have the patients treated with DEBRICHEM, and it's the effect in the first 3 weeks after applying DEBRICHEM. And on the right is the first 3 weeks of all the other treatments of all our other wounds in our database. So if you look on the wound surface reduction, in the first 3 weeks after using DEBRICHEM, the wound surface decreased by 77%, which is quite a lot. And if you compare it with the rest of the database, we see a wound surface decrease of 24%. And if we do the same picture, but then compare it with the same patients that were treated with DEBRICHEM in their initial treatment, at the first 3 weeks, we even saw an increase in the wound surface. And keep in mind that the picture on the left is after average in 138 days. And here we do the same, but then we focus on the tissue. So at the first 3 weeks after applying DEBRICHEM, we can see an increase in granulation from 76% to 83%. And after 1 week, there wasn't any necrosis. We did see some after 2 weeks, but then after 3 weeks, there wasn't any necrosis. And if you compare that to the standard of our care, you see a very different picture. Granulation stayed relatively the same, necrosis also. So you see a more dramatic change in at the picture on the left. If we then once again compare that to the same standard, to the same patients, you can see that when we first started treating those patients, we didn't really get any result. And then after average 140 days, when we were using DEBRICHEM, we saw very good changes in the wound environment. Well, the preliminary results so far, we've referred 1 patient to the hospital. 2 wounds we transferred to another caregiver. 2 treatments were ended with no further explanation. And 18 of the 23 wounds that already were finished did completely heal, as you can see here, which is above our average for our entire database. Considering we've also had more complex patients, I'd say that's quite remarkable results. So for the conclusion and discussion, we see a faster wound surface reduction than compared to our standard of care. We see a visible trend of improving wound conditions. We did focus on very complex wounds. So I'm curious to see what the effect would be if we applied it on more wounds with less strict inclusion criteria, if we could perhaps change that outcome as well. And to do a proper cost effectiveness analysis, we still need some more data, which we hope to have finished by next year. So maybe we'll see you again then. Thank you.